Hello, Dr. Mini PG, Specialist Gynecologist, RUKN Medical Center, Ajman. Today we can discuss about ectopic pregnancy. The natural site for pregnancy is inside the uterine cavity. If pregnancy is not growing inside the uterine cavity, other than anywhere it is growing, it is called ectopic pregnancy. It can be in tube, it can be in ovary, it can be inside the abdominal cavity, or it may be in cervix. Usually, most common ectopic pregnancy site is fallopian tube. That is because the zygote is formed by fusion of ovum and sperm inside the fallopian tube. From the fallopian tube, with the movement of cilia and the peristaltic contractions of the tube, this zygote is transferred inside the uterine cavity. Any problem happen to the movement of the zygote to the uterine cavity, it can get implanted in the tube, and that is, it cannot grow in the tube, and it causes the tubal pregnancy. And this tube, if the pregnancy is growing, that tube may burst and it will end in an emergency situation. The diagnosis of ectopic pregnancy is little tricky. First of all, once missing the period, we have to do an blood test, serum beta HCG test, and assess the hormone value. Then we have to do the ultrasound scanning, either abdominal ultrasound or transvaginal ultrasound. In that case, sometimes we can see the sac of the pregnancy outside the uterine cavity. Uterus may be empty. But to get scanning and ensuring that no pregnancy in the uterine cavity and sac is growing outside, sometimes the picture may not be that clear, especially in the initial stages of pregnancy. So it is very tricky. So monitoring of the patient should be every one or 2 days. Patient has to be monitored serially with this beta HCG and ultrasound scanning. With that only we can diagnose the ectopic pregnancy. But sometimes this ectopic pregnancy will present with acute symptoms like abdominal pain, little bleeding, and patient sometimes may collapse also if the tube ruptures.